audiologist here at Accent on Hearing. I've been here for about 4 years now, and I'm originally from Southwest Florida, so I'm a long way from home. I'm also in my third trimester, so I'm so excited to be,
Cool.
yes, I'm so excited to be having my first baby girl. So we're very excited here. We have a lot of things happening in 2021. So we're looking forward to a much better year in 2021. So I wanted to, Shannon is our audiology assistant as well. She works really closely with our patients as far as hearing aids go and cleaning them and things like that. So we're going to talk a little bit today. I have a PowerPoint that I want to share on the screen. I do believe this is being recorded. So if you need to come back to it, I'm sure they'll be able to share that with you. I do have some PowerPoints that'll have some information on there. If at any point in time you feel like you excuse me, you feel like you have any questions, feel free to turn your microphone on and just ask me, and I'm happy to clear some things up. So um, I'm going to go ahead and share my screen. And if there's anything in particular you guys want to talk about, I'm also happy to touch on those things and answer those questions. But I'll go ahead and get started. Sound great? Good.
Yes.
All righty, here we go. Um, all right, pretty good. Here we go. Okay, can you guys see that okay?
Yes.
Great. So I'm just going to click through here and kind of go through. So this is our team. Joanne Laporta is the owner. She's the audiologist. She's been here at this location here on Perry Street here for 14 years, I think. So we've been here for quite a while. I jumped on board about 4 years ago. Irena's been here for, she's our business manager. She's been here for about 10 years. And Shannon has joined our team for about 3 years. So it says she's a patient care coordinator, but she's also our audiology assistant. So we are located right down the road, so not far. So a couple of things here. We're just kind of, these are some things that we'll just kind of go over today. So we're going to talk about hearing loss and types of hearing loss and how to have your hearing tested. Communication strategies. We'll touch on some hearing aids. We'll also touch on tinnitus as well. And we'll kind of bring everything together there at the end. I know I only have 30 minutes, so I'm going to try to go through the quick stuff quickly and then spend a little bit more time on some. So Sounds of Life, this is really just focusing on hearing. So, everybody, usually develops their hearing loss pretty gradually. That's usually how we develop our hearing loss. We don't really notice changes in our hearing, but we notice that television kind of volume going up. Or our families actually will notice that we're having trouble with our hearing before we even notice we're having trouble with our hearing. So we'll hear from family and friends on, I have to repeat myself a lot, or I've noticed that, when I come visit, the TV up a lot, or you're not really quite hearing grandchildren as well. You misunderstood that. Um, you forget that you might not hear the rustling of the leaves as well as you did before. Um, Music starts to sound a little different. So those are all different things that sounds in our life that just start to change, and it just happens so gradually. It's not, most hearing loss happens gradually over time, over many years. There are some hearing losses that happen suddenly, but the ones that happen suddenly are more of a drastic change in your hearing. Those gradual hearing losses, you tend to just kind of live with it, is really what some of our patients kind of let us know. So it's definitely isolating. It can lead to depression um, because you find yourself saying, well, I go to this busy place, it is so noisy there, and I don't quite understand everybody, so I'm just not going to go. And you go or you do go and you misunderstand things, so things can be a little isolating, and it can cause depression when you don't hear all those sounds that we're used to. It's also really important. Hearing is very important for just personal safety. So if we're out walking dogs or we're out with a walk with friends, we're not going to hear, when you have hearing loss, you're not going to hear those safety signals as quickly as somebody who has no hearing loss or has aided hearing. So, you're not going to hear the car come up as quickly as you would if you had treated your hearing loss. So all of those things can be very important for your safety. Um, Baby's crying, or let's say you're at home and you have a hearing loss and you have your TV turned up, but somebody's yelling outside, fire, fire, fire. You're not going to hear them as well if you have a hearing loss or you haven't treated your hearing. Somebody who might be treating their hearing with hearing aids, or somebody who just has normal hearing, would hear them a lot quicker and a lot sooner. So it's important to definitely treat it for safety reasons. So really quickly, some anatomy here. This is a picture of an ear. So this is this pinkish large part is part we see all the time. That's the outside of our ear. It's what we call the outer there. And then this long tube, pink tube canal or channel is the ear canal. That's where we develop the earwax. That's where our earwax builds up, or we get itchiness in our ears, things like that. And then this bluish figure there at the end of this channel is the eardrum. That's the part, the membrane that vibrates and sends signals and vibrations down to the inner ear, which is our snail-like structure. That's where we have little hair cells that stand up straight up. You can think of them as like seaweed under the ocean. They stand straight up, and then when they're surrounded by fluid, actually, and so when vibrations come down and they disrupt the fluid, just like seaweed under the ocean, our hair cells move, and then it creates an electrical impulse down to our brain, and then we can say, "Oh, somebody called my name." And that's the gist of how sound works. It goes down that channel, vibrates that eardrum, and then to your snail-like structure, and you hear sound. And then again, these are just more of the detailed images of parts of our ear. So we have the outer ear, we have the pinna is what we call it, the ear canal. We talked about that. This is the middle ear. There's that eardrum there. Those are where sounds vibrate and then send them down the bones. And then there's our cochlea. That's where we have all those little hair cells inside of there that move around and create an electrical impulse so that we can hear people say things and understand things. So types of hearing loss, there's multiple types of hearing loss, one of them being conductive. That's going to be more when the transmission of sound is disrupted somehow. Either there's earwax in our ear, the bones in our ears aren't working properly, something's going on with our tympanic membrane. So when you have something physiologically in the ear canal, or the eardrum is affected and it's affecting the conduction of the signal, we have what's called a conductive. Those are usually a little bit more common in people who have ear infections. It's a good example. Children. We do see some conductive hearing losses with adults as well, for other various reasons. But the second one is the sensory neural hearing loss. That's probably going to be the most common hearing loss. And that one is when the hair cells in our cochlea, which is the snail-like structure in our inner ear, when those hair cells have been affected. So they do get, So those hair cells, whenever they get damaged, they're going to get damaged with aging. They're going to get damaged with things that in our medical history, like heart conditions, diabetes, hyperthyroidism. Lots of different things can lead to the sensory neural hearing loss, noise exposure, things like that. So when those hair cells get damaged, they kind of disintegrate and they just disappear, not there anymore. And that's when we have a sensory neural loss. Both, those conductive and sensory neural can both be treated with hearing aids. Mixed hearing loss, you can kind of guess there, is a mixture of sensory neural and conductive. And then retrocochlear hearing losses are a little bit more, they're rare, but they are hearing losses that you're born with these. It's hearing loss that is in the auditory nerve, so more down past that cochlea, past that snail-like structure. So those are going to be more hereditary, and you're usually born with them. But I would say that majority of my patients have a sensory neural hearing loss, and we treat all of these with hearing aids. This is a pretty fun little image just to give you a visual of what hearing loss looks like. So now that we know, different types of hearing loss, we know, okay, yes, I do have trouble hearing my family sometimes. I don't, but it's not totally apparent to me. But what is it like for somebody who really lives with hearing loss every single day? And this is really a good image. So, perfect hearing, of course, is you read these words perfect. Perfect hearing looks like this. But when you have hearing loss, it's unclear. It's not very defined. The words kind of blend together. You don't really know where one word stops and the other one begins. So that is a good image. It's a good visual of understanding hearing loss. So this chart here just has some statistics about hearing loss. So really one that I really like to always kind of, focus on is hearing loss is even though you have hearing, you're not hearing and we relate to our ears, because that signal is not being transmitted down the auditory nerve to our brain properly like it was when we had normal hearing, changes start to happen to our brain. So if I can direct your attention right here to this, to this side of the graph here that says 2 times, 3 times, and 5 times with the arrow that's going right through the middle there. So what that chart is really saying when you have a mild hearing loss, you're 2 times more likely to develop a cognitive delay like dementia. As your hearing loss increases to more of a moderate or even more of a severe loss, those chances multiply. So you're 3 times more likely to develop a cognitive delay and even 5 times more likely to develop a cognitive delay as it passes that moderate loss range. So I would say that most of my patients who come in for hearing loss usually have a moderate to a moderately severe high frequency sensory neural hearing loss. So most of those mild losses are happening are at a younger age, which is why we always recommend a hearing test by the age of 50, like a baseline. So we can kind of see, that's when we start to see changes in hearing. So if you haven't had your hearing tested recently, it is a good idea to just kind of see where you are to monitor any changes if there is any hearing loss there. Most people with hearing loss experience a 30 to 40% faster decline in cognitive ability. That's really just because you're not getting that clear signal. You're not getting that understanding that we did before, and parts of our brain are starting to shrink and atrophy. So that's where the link is. The brain doesn't get that stimulation. Brain's number one job is just self-preservation. So what it's doing is it's just going to say, well, if I'm not using those parts of my brain, I'm just going to put it in that energy somewhere else. So as I mentioned earlier, your medical history can lead to some changes in your hearing. So high blood pressure here has a significant association. You are more likely to fall. You have a 3 times more likely chance of falling whenever you have hearing loss, and that is because you're not so aware of your surroundings, you're not hearing. So if you have a difference in one of your ears, that can kind of put you off balance as well. So, and 90 to 95% of people with hearing loss can be treated with hearing aids. That's like, that's that sensory neural hearing loss that we talked about. That's most of our patients. And, it does talk about depression and anxiety and things like that. And, those things do happen with people who have hearing loss because they don't associate with people because they can't hear them or understand them, and sometimes it's just embarrassing. So they just feel embarrassed if they misunderstand somebody. So I find this chart to be very helpful, very eye-opening to really just understand, wow, there are a lot of people out there with hearing loss and understanding how it connects to our overall well-being. So this is another graph about types of hearing loss. It just goes into what a conductive hearing loss is. I'm just going to go through these really quickly. If you are aware that you have a certain kind of hearing loss, if you have a conductive hearing loss versus a sensory neural hearing loss, and it's something you'd like to go into a little bit further, I'm happy to talk about what those things. But I'll just briefly go through these. Again, conductive hearing losses are due to an issue with conduction of signal, like earwax, damage to eardrum, things like that. Sensory neural hearing loss is going to be directly related to the cochlea, which is going to be in that inner ear, causes our aging. You could live in a bubble all of your life, and just simply the aging process will cause some sensory neural hearing loss. Noise exposure. There are some hereditary factors. If your family has hearing loss and had hearing aids, chances are that it could roll over to you too as well. So again, hearing aids very helpful for both of those. And this it is important to mention that I'm going to go back really quickly. Conductive hearing losses can sometimes be treated medically. Antibiotics, if it's an ear infection, if it's earwax, we just remove the earwax and things like that. Sensory neural hearing losses are in the cochlea. There's no medical treatment for sensory neural hearing losses other than this. So keep that in mind. And how does the evaluation work? So if you did want to have your hearing tested, how would that work? So couple things with COVID, we are seeing patients. We just do a COVID screening to make sure you haven't had any exposure to anybody with COVID, and you weren't experiencing any symptoms, of course, but we are still seeing our patients in office for diagnostic evaluation. So you can call and schedule an appointment. We will put you on the schedule, and you would come in, fill out some paperwork if you haven't filled it out already. And we bring you back into our test room. We go over your history with you. We, put some headphones on you, play some sounds in your ears, and you respond to whether you hear them or not. And we put all of your results together on a screen and kind of go over what your hearing test looks like with you. We then determine if hearing aids are going to be beneficial for you, if it's going to be the next step. At that point, when we talk about hearing aids, we talk about different levels of technology. So there's different types of hearing aids. There's hearing aids that go in your ear, hearing aids that go behind your ear. So we would go through all of those things. Usually the evaluation itself, just the testing, takes about 30 minutes. Going over results takes about 30 minutes. And if you did decide you wanted to try something, if you wanted to demo a set of hearing aids, that takes about 30 minutes as well. So if we did the whole entire appointment, you're looking about an hour and 15 minutes for the entire appointment. We do look into your insurance as well. So if you have insurance and you are curious to see if there's a hearing aid benefit there, if your insurance covers hearing aids, we'd be happy to look into that for you. So again, this just goes through every part of the exam here. So these evaluations are scheduled with myself or Joanne, the other audiologist. This is what the graph where we would plot your hearing test would look like. So the red circles are your right ear, the blue X's are your left ear. That's somebody with very normal hearing. That would be my husband. And then he complains that he doesn't hear me, but he hears very well. And I have proof of that. So it's very much selective hearing. And we will test that once the baby's born. So as your hearing changes over time, you can assume that your hearing was like this whenever we were teenagers, in our 20s and maybe early 30s. And then as time goes on and we experience life, we go to concerts, we listen to music, or let's say we develop some high blood pressure, or we all of a suddenly have a heart condition, and or we have a hypothyroid, things like that happen, our hearing starts to slowly change. So it'll slowly start to fall into this mild range, and then moderate, severe. And if it gets to a point where it's pretty significant, it'll be way down there at the bottom of the graph. But essentially, this is what the graph looks like. There's volume or intensity on one side, and then at the top there, you'll see those are pitches. So we test 250 to 8,000 because those are the pitch ranges where speech generates. So those pitch ranges are sounds of speech. So we're really just focused on what parts of speech you're not hearing. And an example of a hearing changing over time. So normal compared to changes in your hearing. This is a very common hearing loss. I see this a lot. This is an example of the sounds of our environment. So where does a dog's barking fall on that graph? And where does the sound of water trickling from the faucet, where is that at? Birds and leaves, you can see those are pretty high up on the graph. So those are going to be more softer sounds. And as you go down, you can see there's an airplane way down here. There's gunfire and fireworks. Those are really, really loud sounds. So you can see that two people having a conversation, that's right around that middle, in that middle of the graph there. It's a pretty soft sound. And if we just kind of take a brief, just mental picture of those two people not on that graph, and then let's just bump back over. You have a hearing loss. If your hearing is this curve here that of the hearing changing, and you can imagine that people talking are right in the middle, and this is your best hearing, you can assume that you're going to have trouble hearing people having those conversations. So that's a good example there. Of course, we talked about impacts of hearing loss. Earlier, we talked about like the psychological impacts of depression and isolation. But when you're not hearing and you're having those troubles with those higher pitches, you miss the difference between the words, between like the F, the S, the TH, the S sound, the K sound. So those are going to be the sounds like deaf, death, and desk. So those three words there are different, but they have the subtle changes are right at the end. And if somebody's wearing a mask and is covering up their mouth, or has their back turned to you, those subtle parts of speech you'll miss. And you'll say, did you say death or death? Or desk? Then you have to use your context clues. Well, I'll just use the rest of the sentence to figure out what they said. But if you're so focused on trying to catch the first part of the sentence that you miss the last part, you then just start to say, well, I don't even remember what they said at the beginning. So all of these things slowly start to, collide together, and you have this effect of, I don't know what she was talking about, and I tried to pay attention, and I put so much effort into trying to hear. So something to think about. Diseases that can affect your hearing. So we did talk briefly about medical history, and I mentioned, high blood pressure, but diabetes is a big one. So if you have diabetes, this might be a good idea to just have your hearing tested. And it talks here about how it affects your hearing, and it affects your hearing because it affects the nutrition to those hair cells that are inside that snail-like structure, that cochlea that we keep talking about. So 79 million adults thought to have pre-diabetes, the rate of hearing loss is 30% higher than in those with normal people without diabetes. So something to think about there. Heart disease. This is also going to affect the nutrition to our cochlea. And hearing loss appears in almost 80% of people with cardiovascular disease. So something to think about there too. Kidney diseases. Our kidneys and our ears actually develop at the same time in utero. So that's why usually these are typically linked together. So if you've had some kidney issues throughout your life, chances are you've probably had some hearing changes in your hearing as well. Some drastic, some not so drastic. And then if you develop kidney issues as well in life, it can affect parts of your hearing. So big question that we always get, tinnitus. I have this ringing in my ears. I don't have any trouble with my hearing, but I have this constant ringing. So most people notice this ringing in their ears before they actually notice any changes in them. I would say that about 90% of my patients have hearing loss, aren't aware of it, but notice the ringing. And usually the ringing is a phantom signal that our brain regenerates. Our brain is kind of saying, oh, I used to hear the sound normally. I don't hear it normally anymore because I have hearing loss now, but it's just constantly playing. Most people hear it when they're most tired. So either early in the morning, right before they go to bed. And it's also worse with stress. So the more stress you have, the more you're going to hear your tinnitus. Changes in your medication can also cause ringing in your ears. So something to, if you already have ringing in your ears and you are going to have some changes in your medication, do a little research on those if they're going to cause more tinnitus, and talk to your doctor about it too. We always recommend a hearing test just to eliminate hearing loss as a factor for the ringing in your ears. And ringing in your ears can be treated with hearing aids. The way that treatment happens is you program the hearing aids to your prescription, which is your hearing test. You're essentially giving back your brain those sounds that it's missing. And so when you give back those sounds, your brain says, oh, there it is. There's that sound I was searching for. And it doesn't have to regenerate it all the time. So it gives you a calming relief to your tinnitus. Now, it doesn't make it go away and it doesn't cure it, but it does allow you to get some relief from it. So that's just my brief on tinnitus, but I could go on and on about tinnitus. But if you have any more questions about that, you can always just let me know, and I'm happy to talk to you more about it. Tinnitus treatments, as I mentioned, hearing aids. There's also some options for some maskers, is what we call them. They're just relaxing, soothing sounds that play inside the hearing aid very softly in the background. So it's a very subtle sound that you hear, and it just kind of calms your brain. It gives your brain something else to listen to, and it allows for you to, because tinnitus is so closely related to stress, it elicits more of a relaxation so that you're not eliciting that stress hormone, and it just kind of calms your tinnitus down, I should say. Medicine and drug therapies. There are some things over the counter that are advertised to treat your tinnitus. They're called lipoflavonoids. We have an ear, nose, and throat doctor that we refer all of our patients to for medical evaluations of their hearing. And there are times where she does recommend lipoflavonoids. Some of my patients have success with them and some of them don't. It's very hit or miss with them. Usually because the lipoflavonoids, there's just really a lot of vitamins inside of them, and there is a blood thinner inside of some lipoflavonoids, so they can thin your blood out a little bit and sometimes can give you some relief from your tinnitus. But I haven't found any concrete evidence that says that lipoflavonoids will absolutely cure your tinnitus. Everybody develops their tinnitus differently, so medicines and drug therapies are kind of a hit or miss. I would say try them. If they work, great. if it doesn't, I wouldn't be super surprised about that. So tinnitus retraining therapy, this is where we would use hearing aids, or we would use a sound to train your brain to listen to focus on the relaxing sound and not the ringing. And of course, counseling, just, sometimes just talking about it and being aware that you have it may never go away, but there are things that we can do about it really helps. So, and of course, relaxing. So, great excuse to just introduce more relaxation into your life too. So, noise exposure. This is a big one. Anytime you're exposed to noise, you're going to have some effects in your hearing. It may not be permanent, but there are going to be some effects that can happen to you when you're exposed to hazardous noises or noises that can be damaging. So I would say that conversation is about 50 to 65 decibels is how we measure volume in audiology. So intensity. So a 65 dB signal is somebody just talking really, really loud. Somebody who is mowing their grass is going to be exposed to the lawnmower. That's about 80 to 100 decibels in loudness. So it's a pretty huge jump there. You can only be exposed to 80 decibels of sound for 8 hours before you have any permanent changes. So at a chainsaw, for example, is 100 decibels. You can only be exposed to that sound for 15 minutes before you have changes in your hearing. So if you know anybody who is, works outside in their garden all the time or cuts the lawn a lot, hearing protection. Always wear hearing protection. On this graph here, you can see way at the top there, gunshots are about 120, 140 decibels, and those are extremely damaging. You can only be exposed to those sounds for not even seconds, because it'll just permanently damage your hearing, and the damage is happening in your cochlea. Damage is happening to those hair cells in that snail-like structure. So just keep in mind, always wear hearing protection, even when you're around fireworks, or even when you're, watching somebody, watching like a fireworks celebration that, we just did one for New Year's here in Castle Rock. It's important to just, make sure you wear some hearing protection if you're close by. So yeah, noise exposure. Hearing protection, we do custom hearing protection here, meaning we take an ear mold impression of your ear, and then we have the custom protection made for you. Those would be a little bit more pricey, of course, because they're custom, because they're specifically made to fit your mold in your ear. It's going to give you a lot more of a secure fit, and it's going to give you more confidence that it's fit properly, so you're getting that noise reduction that you're supposed to. But these are all just some other examples. So the orange with the little swirlies are custom, but the yellow foam pieces are just over the counter. Same thing with the ones with the cord. And then these down here, these white ones down here have some phalanges and some a filter through the middle. Signs of hearing loss. Let's see, people around you seem to mumble. So these are just some things that we just get from our patients. They're like, well, if so-and-so wouldn't mumble so much, I would hear them better. But sometimes that's just because sometimes a person does mumble, don't get me wrong. And that's just a trait. But most of the time it's just because your brain is processing it. You often ask others to repeat. So, these are things to just be aware of. Difficulty following conversation when the background noise are in groups. And that's because your brain can't tell the difference between conversation and background noise. It all just gets muddled together. Children and women's voices are difficult to hear. Those are going to be more high frequency sounds. And usually most of our patients have a high frequency hearing loss. So you can imagine that those would be harder for you to hear. Need to turn the TV or radio up louder. over time, with the hearing loss being so gradual, you may not notice that the TV is louder. But when other people come over, or maybe your spouse is mentioning that, yeah, the TV is loud or the radio is loud. Can't hear high pitched sounds such as birds, crickets, and bells. If you remember back on that graph, we talked about how soft some of those sounds are and what frequencies those fall at. So those are all things that we can try to get back with your hearing aids. Communication strategies. It's always important to make sure that when you do have a hearing loss, to advocate for yourself and let people know, I do have a hearing loss. My hearing is changing. It changes, gradually. So it's better if whenever somebody's talking to you, talk to turn their direction, turn themselves to you so that you're looking at them, because you do rely on visual cues of their facial expressions to better understand them. Or have them call your name first before they want to say something important to you. Make sure you turn off all the background noise. So if their head's in the cabinet, faucet's running, the dishwasher's going, the TV's on, yeah, you're probably going to have a hard time hearing them, even with your hearing aids. So it's just something to keep in mind. Anytime you can reduce the background noise, it's always going to be better for you if you're to hear them and understand. So these are just some more statistics about hearing loss. More than 31 million Americans admit to having hearing loss. 1 in 3 people older than 60% with a hearing loss, and half of those older than 85 have hearing loss. Hearing loss is one of the most common conditions affecting older adults. The use of hearing instruments lessens the effect of hearing loss by at least 50%. So hearing aids do slow the progression of your hearing loss down. They will not stop it. They do slow it down. So we do see less change in your hearing over time when you treat your hearing loss compared to somebody who doesn't treat their hearing loss. What are the steps to better hearing? So obviously we need to see what your hearing looks like. And then from there, we just see how you do with hearing aids. If it's appropriate to fit you with hearing aids, we would do a demo. We would demonstrate some hearing aids with you, and then go from there. Really just decide on if this is going to be something that's going to work for you. Of course, it's going to benefit quality of life. Is one thing I always like to talk about. So your hearing aids are going to make you feel more confident. Oh, I hear people so much better now. I don't have to guess to what they're saying. Strengthen those personal relationships, better self-esteem, just better quality of life overall. So the fitting process, of course, when we fit you with hearing aids, there's the assessment, the treatment, planning, selecting which one's going to be best for you, verifying that everything sounds good, and then, validating that this is something you want to move forward with. These are just some images of some types of hearing aids. They come in several different types and shapes and colors and fits, and these are just some very basic pictures. I think most people are used to seeing this one here, the behind the ear option that's really big and bulky there towards the bottom, and you see it, and everybody's always remembers that hearing aid. But honestly, those hearing aids are for people who have very, very, very significant hearing losses. I would say that your usually or most common one is going to be the hearing aid that is a little bit more discreet. It's going to be this hearing aid here. I'm not sure if it's towards your right or to your left. I don't know how it flips over on your screen, but it's got this little black piece there at the end, and you can see on her ear, you just see the tiny little wire, but you don't see the hearing aid. That's going to be our most common style that we fit. They also have some in the ears, and you can see this style, it's completely invisible. You don't even see it in the person's ear there. So depending on your hearing loss, of course, will be dependent on the style that we choose. Also, just dexterity, rechargeability is a big thing. You don't have to worry about batteries for most of these hearing aids. So something to just keep in mind there. They come in several different shapes and sizes. New styles of hearing aids. So one invisible style that we do fit here in our office. We are the actual only Castle Rock provider of this hearing aid. It's called the Lyric. The Lyric hearing aid is an invisible in the ear canal device. You wear it 24/7. It sits in your ear for about 8 to 13 weeks. Some of our patients can get about 13 weeks out of their devices. These devices are meant to sit in your ear 24/7. You shower with it, you go swimming with it. As long as you don't get any water in your ear, the device works really, really well. It's completely invisible. Nobody knows you have it on. And about every 8 to 13 weeks, once the battery inside the Lyric dies, you just give us a call. We take it out, we put it in. So that device is really nice. It's very convenient and easy to use. You just, it's a fit and forget essentially. A lot of hearing aids connect to Bluetooth today, so they'll connect to your cell phone, they'll connect to your watch. They're rechargeable, so that's what the case there is. That green case is a charging case. They just sit inside a little case and just charge. And the red hearing aid there at the very top is just showing you an example of how, that's an in the ear. It can go way, way down inside your ear. So all kinds of different things. Of course, fitting both of your ears is better than just fitting one. If you have a hearing loss in both ears, which most people do, we fit both ears so that you hear in surround sound or stereo. When you fit just one ear and not the other, the ear that isn't treated or doesn't have a hearing aid will get weaker faster. So we don't want to have any more imbalance because hearing loss already leads to balance issues. So always 2 ears. Digital hearing aids. This is going to go more into the features of the hearing aids. I won't spend too much time on these. Just know that there are definitely different levels of technology, and some hearing aids are very sophisticated, and they track your walking, they track your usage, they track how much different environments that you've been in. So we can always go through the different features if you have any questions, but they have tons of clarity and noise reduction, and so connect to your TV and connect to your phone. So they do all kinds of things. Again, connectivity to Bluetooth, like this is just showing you one that tracks your walking, tracks your brain activity. And of course, different levels, so premium and advanced, performance, and an essential. So those are all the different levels of technology, but like I said, we can go through all those in more detail. I don't want to spend too much time on that. And how to choose one will determine which one's going to be the best for you depending on your environments, your lifestyle. There's so many things that go into choosing your hearing aid. So we'll sit down and do that with you. And that is it. So I know I took most of that time up. So I just I gave you guys a lot of information. I know this is recorded, so it's if you all have any questions, feel free to jot down our number here. Our website also has the option of sending us a chat where you can schedule. There's also a hearing screening option on our website where if you'd rather test your hearing at home, you can screen it at home on our website. There is also the option of drive-up hearing test here at our office if you wanted to do a quick screening, but wanted more of like a diagnostic, detailed explanation of it. We can do your hearing screening drive-up with our portable audiometer. It's just a little iPad tablet that you wear some headphones and press the button when you hear the sound. But the screening on our website is great too. So it kind of gives you a little bit of information. And then, of course, if you'd like to come in for an appointment, give us a call and we're happy to schedule you. So I'm going to stop sharing the screen here and come back. Does anybody have any questions for me? Doesn't
Thank you
look
for
like
being
it,
here with
so-
us. I do have a question.
Oh,
It's
yeah.
for Shannon.
Yeah.
We have a lot of questions from our seniors about that it's really hard for them to get on the computer or Zoom because it's hard for them to hear.
Yes.
Do you know of any devices or any anything to help with that makes it more friendly towards that?
Yeah, so I would probably say they probably either need to wear like a headset
Mhm.
that has like an option to increase the volume on there.
Mhm.
That would probably be helpful because the closer you can get the signal to the ear, the better that would be.
Okay.
The next thing would probably just be captioning.
Okay. That helps.
Yeah. So captioning, turning on the captions on your Zoom would probably be a good option, or wearing a headset. Yeah. Anything else? I went through a lot very quickly. So if you guys have any questions, feel free to, you can shoot us an email at accentonhearing@comcast.net. That's our email address. And of course, we have text options on our website if you rather that, or if you'd rather the good old phone call. I love a great phone call. So
I think we'll go ahead and close it for the day then if nobody has any other questions.
Thank you.
Thank you.
Thank you guys again for
oh,
being
it was
here.
my pleasure. Thank you so much. And you all have a fabulous 2021, and we look forward to seeing you in the future.
Bye, everybody.
Bye.